he's a 4-month-old child or a 6-month-old child or maybe a 12-month-old child, and then on examination or asking for the history, you find out that the child is not vaccinated. Now when the child is not vaccinated, from how you are going to start, because he did not have any vaccinations at birth, he did not have any vaccinations at 2 months or 4 months or 6 months, then the way forward is you first need to find out what are the vaccinations that he has. Sometimes there is a partially vaccinated child or no vaccinations. If there are no vaccinations, then you will start with the first dose of every vaccination. So here if you see the chart, IPV, OPV, so if the child is 6 months, he is also eligible for OPV and IPV both, right? But if the child is at 4 months presenting to you not vaccinated, you will give IPV only, no OPV according to the schedule. So you will give every dose, first dose of every vaccination. Like here in 6 months, you will give OPV, IPV, DTaP, hepatitis B, Hib, pneumococcal, and even at the B and even the BCG. But this time, this will be the first dose of every vaccination. But if you go with the schedules, he will have third dose of these vaccinations. But now in this case, because he is not vaccinated, it would be the first dose. And then you will ask the patient to come revisit after 4 weeks and then revisit after 4 weeks. So he is at 6 months. Usually if you follow the schedule, he will come at 9 months. But now in your case, because he is an unvaccinated child, and the bunch of vaccinations that you are giving is a combination of live and dead vaccinations, you ask the patient to come to revisit after 4 weeks to give the second dose of these vaccinations previously missed. Then after 4 weeks to give certain set of vaccinations as a third week, and then by the end of 9 months when he will come, he will be up to date to that person. Whether is it a case of 9 months of child, whether is it a case of 12 months of child or a 6 month of child, the concept is you will give all the vaccinations that are required, but the doses will be different. First dose, give all the vaccinations first dose at this visit, then after 4 weeks, then after 4 weeks, and then after 4 weeks. Any vaccinations who are live vaccinations, okay? Sometimes the nurse will say that, okay doctor, all the vaccinations are there, but we don't have OPV right now. Okay, so he already received some of the live vaccinations. The OPV will be available tomorrow, but you don't ask the patient to come tomorrow, because 2 live vaccinations at the same time you don't give it. You give it live vaccinations 4 weeks apart. Actually 3 weeks apart, but minimum you require it 4 weeks apart. So if OPV is not available now at this stage and he received some of the live vaccinations at this visit also, other live vaccinations, this OPV you will ask the patient to come and receive it after 4 weeks, not before that. 2 live vaccinations cannot be given 1 day or 2 days apart. You can give all the live vaccinations at the same time, no matter it's 2, it's 3, but if it is given at the same time, same day, no problem. But if one vaccination live is not there, you ask the patient to come later on 4 weeks apart, and then you will give it with the other vaccinations, no problem. Because here if you see at 9 months there are measles. Measles is a live vaccination. And that's why and it is the minimum age of the measles is 9 months. So you don't give measles at 6 months. For instance, the child is presenting to you at 12 months of age and he's unvaccinated. So you will give all the previous dose vaccinations as a first dose, plus this measles, meningococcal vaccinations, measles, meningococcal, MMR also in this, because he's a 12-month-old child. Okay, obviously you can, and also you need to see the minimum age and the maximum age of the vaccinations. MMR is not going to be given before 12 months. If the child is coming to you at 9 months and you don't give MMR, obviously, because MMR it's not the age for the MMR. Same goes with the measles. The minimum age is, you see here, 9 months. You don't give measles before 9 months, obviously, right? So you need to make sure. And by the way, there are some upper, like Hib. If the child is coming to you maybe at 8 months, you're not going to give Hib now, although the child has not received Hib vaccinations. But there is also an upper limit for the Hib also. So you need to see the maximum ages. Same goes with the rotavirus. Rotavirus, if he did not receive the vaccinations at certain age, after that age, if he is coming like 8 months, like 18 months or 2 years of age, it's not going to be effective for the rotavirus, and same goes with the hip. So that's one thing. DTaB is, one is DTP and one is DTaB. What is the difference between DTP and DTaB? In yani AP is acellular pertussis, and the second one was the cellular pertussis. Pertussis is, I think, it's live vaccinations. All right, thank you.